Today we're going to be dealing with seizures and what that means. There's many causes of a seizure. That could be low blood sugar, that could be not enough oxygen in the body, that could be drugs or chemicals or poisons. Many things can cause seizures. But typically what a seizure is when too much of the brain is trying to communicate with too much of the brain at one point in time, and the brain doesn't know what to do, so it kind of just shuts off. What this looks like is the body shakes. A normal kind of seizure, or the most common type of seizure, is when the whole body gets stiff. So all the muscles stiffen up, and then they relax and they stiffen up, and they relax and they stiffen up. This is called a grand mal seizure or a tonic-clonic seizure. I know these are big words, but they're not really that important. Tonic means tone, and clonic means relaxation, and so there's this shaking of the body where the muscles contract and relax. All the muscles contract and relax. This is dangerous because if all my muscles are contracting and relaxing, how do I breathe? So you can't really breathe if you're having a proper seizure. The other thing is to notice that there are many other kinds of seizures. So what this means is that you might have a partial seizure or a Jacksonian seizure, or there's hundreds of other kinds of seizures, but the one that's really dangerous is when you have the whole body shaking. So you have a tonic-clonic, that whole contract, relax is very dangerous. The others aren't that dangerous. You have some seizures where you can just stop for no reason and they're not even aware of it. So what are you going to do about a seizure? So if you've watched my previous video, if you haven't watched my previous video, it's hazards, hello, help, airway, breathing, circulation, always. If they're having a seizure, you're going to put them into the recovery position. This can prove pretty difficult because they're seizing. Don't tie them down, don't try to hold them down, don't put anything in their mouth like spoons or honey or whatever the case is. They're going to probably be frothing from the mouth. Just turn them on their side and let them seize on their side. It's not that difficult. Remember to be careful of any hazards. Sometimes they can bite because their jaws clenching, open, close. All these things are hazards to you. So if they're near chairs or tables or whatever the case, you can remove things, put them on their side and let them seize on their side. Try and record how long they're having the seizure for, just so you can tell the paramedics, and to monitor their breathing once the seizure is stopped. Hopefully it stops. They don't always stop. So what can you do about a seizure? So there's not very much you can do about a seizure. If they collapse and they stiffen up and then they have a shaking forwards and back seizure, they'll most likely stop in 2 or 3 minutes. Remember to put them on the side while they're having the seizure. While they're having the seizure, and you put a blanket over them and you reassure them and you stay with them, protect their head, maybe put a pillow under their head. Remember, in the recovery position video, you must also remember to just maintain a close eye on their breathing. If they stop breathing, then they don't have a pulse. Or if they have a pulse and their breathing is obstructed by their tongue, if they're lying on their back, they need to be on their side. If they're on their side, their tongue won't get in the way of their breathing and they should be able to breathe fine. Don't think because they're on their side, they're okay. You need to call for help quickly. Thanks for watching this video. Remember, there is a quiz and a feedback form at the bottom. It really helps me and it really helps you too. So story time. So remember, a seizure can also be caused by low blood sugar. So I had a patient who was having a seizure and I gave medication to stop the seizure and it wouldn't stop. And I really was not sure what was happening. And thankfully, my partner who was with me at that time, I was a very young paramedic and I still had so much to learn. Not that I don't know everything now, but back then when you've on the road for 2 or 3 months as a newly qualified paramedic, you're learning so much so quickly that my partner was like, I think we should check the sugar. And so we checked the sugar and we realized that it was super low. So we fixed the sugar and he woke up and he was like, I'm fine, no problems. And now it was a big lesson to me that seizures can be confused by low sugar, because low sugar, the brain struggles with not enough sugar, and that can present in strange kinds of seizures. It's also really important to remember that low sugar can mimic seizures, and in the previous video, if you watched it, is that low sugar can also mimic strokes. So always be aware of diabetics. Hope that helps. See you again.